Nail problems can be frustrating, especially when you're not sure what's causing them. Two common conditions that affect the nails are nail psoriasis and fungal infections, and although they can look similar, they're actually very different in terms of cause, treatment, and long-term impact. In this video, we'll walk you through how to tell the difference between nail psoriasis and a fungal infection, so you can take the right steps toward getting the treatment you need. Let's start with nail psoriasis. Psoriasis is an autoimmune condition that causes skin cells to build up more rapidly than normal. When it affects the nails, it can cause a range of changes, including pitting, which are small dents on the surface of the nail. You might also notice discoloration. Sometimes the nails turn yellow-brown or develop red spots under the nail plate. In more severe cases, the nail can start to separate from the nail bed, a condition known as onycholosis. Thickening of the nail or changes in nail shape are also common. Nail psoriasis often occurs in people who already have skin psoriasis, but it can also appear on its own. Now let's look at fungal nail infections, which are caused by fungi that thrive in warm, moist environments. These infections typically start at the edge of the nail and work their way in. Common signs include yellow or white discoloration, thickened nails, and a crumbly or brittle texture. In advanced cases, the nail might lift off or even fall off. The skin around the nail might also be itchy, flaky, or irritated. Fungal infections can affect anyone, but are more common in people who walk barefoot in public showers or swimming pools, those with diabetes, or people with a weakened immune system. So how do you tell them apart? First, look at your medical history. If you already have psoriasis on your skin or joints, nail psoriasis is more likely. If you've had frequent exposure to damp environments or have a history of athlete's foot, a fungal infection may be the culprit. Next, consider the appearance. Nail psoriasis tends to show more pitting and oil drop discoloration, while fungal infections are more likely to make the nail look yellow, thickened, and crumbly. Also, fungal infections usually start on one or two nails and then spread, while psoriasis can affect several nails at once in a symmetrical pattern. It's also important to know that sometimes both conditions can occur at the same time, which can make diagnosis more difficult. That's why seeing a dermatologist is essential. They can perform tests like a nail scraping or biopsy to determine whether fungus is present or if it's purely a psoriatic change. Based on the diagnosis, treatment can be more targeted. Treatment for nail psoriasis may involve topical steroids, vitamin D analogs, or systemic medications like methotrexate or biologics if the condition is severe. Phototherapy can also help in some cases. On the other hand, fungal nail infections are usually treated with antifungal creams, oral medications, or medicated nail lacquers. In persistent cases, partial removal of the nail may be necessary. Proper nail care is crucial in both cases. Keep your nails trimmed and clean. Avoid biting your nails or using them as tools. Wear gloves when working with water or chemicals. And remember, nail health reflects overall health, so keeping your immune system strong with good nutrition, stress management, and proper hygiene can make a big difference. In summary, while nail psoriasis and fungal infections can look similar, careful observation and medical testing can help you tell the difference. Early diagnosis and proper treatment not only improve the appearance of your nails, but also prevent long-term damage. Don't ignore changes in your nails. Your body may be sending you a message that deserves attention.